ALL, and in particular, there's been a particular focus on pediatric ALL because these patients in many of the studies have done especially well. And this is irrespective of whether they have relapsed after chemo, radiation, or even after allogeneic stem cell transplant. I think what the caregivers and the patients need to understand, though, is that the toxicities can be as significant as what we would see after an allogeneic stem cell transplant. It does involve the collection of your cells using an apheresis, so you are on a collection device, if you like, and then there is this sort of 10-day manufacturing period, over which time you are also conditioned with additional chemotherapy, which sort of creates the space, if you like, or the right environment for when the T cells go back in. So the injection of the T cells is a very simple procedure, but what we're seeing is about 2 to 3 weeks post T cell infusion, at a time when we know the T cells have engrafted, they've expanded, they've found the leukemia cells and they're killing their leukemia targets. This is a time when we get this cytokine release syndrome, and it is that time that the patient should understand they could get extremely sick, may need to be in the ICU, may have to need mechanical ventilation, can be very significant side effects. And the majority of the patients do make a complete improvement within 2 to 3 weeks after this. But it is important to know that at the same time, some patients have died from this complication.